Welcome to DoctorSaab. My name is Dr. Tanya, and today you are tuning into this episode where we're going to talk about one of the most underrated roles in an operation theatre, the anesthesiologist. Surgery is fascinating, no doubt. But what's the real deal? The anesthesiologist who keeps the operation running smoothly. Today we've got Dr. Rochana Bakhshi, a consulting anesthesiologist at DY Patil Hospital, who would be sharing some of her fascinating insights and real life tales. So stay tuned because today we are going to talk about the MVP of an operation theatre.
Doctor
Doctor
Saab.
Sahab.
Doctor Saab.
Doctor Saab.
Doctor Saab.
Hello, ma'am. How are you?
Hi Tanya, all well.
How has your day been today?
Day was a bit hectic. I was in ENT OT,
Okay.
but today we didn't have ENT cases, so we had to take up plastic surgery.
Acha.
So a bit of high risk for the first case.
Hmm.
The rest of it was okay. But yes, hectic because I was on my toes since morning.
It's actually really nice to see you outside the OT and talking to you here.
Thank you so much for inviting me for your talk.
Thank you so much, ma'am. So let's get started with this podcast. First question that I'd like to ask you is, how was your childhood like, ma'am?
Well, I was born in a joint family. So I was born in Dadar, but very shortly my father shifted to Thane for his work purpose.
Okay.
But then, it was never like, I was staying in a nuclear family because my grandparents,
Huh.
6 months used to be with us, 6 months in Dadar.
Okay.
And all our festivals and all my, vacations were always in my ancestral home.
Hmm.
So, in fact, we were 11 cousins on my paternal side.
Oh my God.
So we used to have a lot of fun, and that bonding is still there between all of us. So, in fact, I remember my elder sister in her first standard, she had to just write about herself. So, on paper, she wrote, I have 11 brothers and sisters. So, the teacher asked my parents, what is this? So, that bonding was so strong. So, it was a very beautiful
You never
childhood.
considered each other as cousins. It was
No,
more like
absolutely. Even now, till date, all of them are abroad. Only we are three sisters. I have two real sisters,
all right.
but the rest of them, they are here, and the rest of the, 8 of them, they're all abroad.
Huh.
But whenever they come, we try to have a reunion sometime or the other, or at least 3 or 4 together. Then we all get together still.
That's really great. This kind of a bonding is rare right now in this era.
Right.
You're so lucky, ma'am, in that thing. Tell me something about your UG experience then.
My undergraduate I did from DY Patil Medical College in Nerul, and it was a wonderful experience. Again, we had some great faculty here. The only little bit of challenge that time, because Nerul was not that developed in 1997. So transport from Thane to Nerul was a bit of an issue.
Huh.
So it's like, we used to run to the station, and अभी बस कौन सी लगेगी हमारी बस जो नेरुल जाने वाली बसेस कम थी, तो वो फिर अनाउंसमेंट होती थी, दोस पुराने स्टाइल में जब एसटी स्टैंड पे जाओ तो एक अनाउंसमेंट होती थी, तो सारे बच्चे, बहुत सारे इंजीनियरिंग ये सब, तो हम सब भागते थे कि अरे, और फिर भागना इसलिए था कि सीट मिल जाए बैठने के लिए, क्योंकि बाकी दिन हेक्टिक जाने वाला है. But then, of course, then the college itself arranged. There were a lot of people coming from Thane and Mumbai side. Then they started arranging buses for us.
Okay.
So then it became quite
like a
smooth.
pickup drop.
Yes. Sometimes friends together we clubbed, and एक की गाड़ी लेने आएगी, एक की. So that's how time निकल गया, but अच्छा time था.
Any like memorable experiences you can think of UG के time पे जो आप कभी नहीं भूल सकते हो, एक चीज या कोई ट्रिप आपने की हो?
One memorable was our first traditional day, all of us together. So that was a nice one, because I think that's where my better half thought of proposing to me. I think so. That must be because I was in a traditional Nawari sari, and wearing my all the jewelry, nathni, and all that. And so that was one good. We have a group photo that time. I don't remember much, but उसके बाद थोड़ा सा मुझे ऐसा लगता है कि जो I met my better half here in DY. So
So I think he must have thought कि हाँ अब propose
शायद
कर सकते हैं. Did you always have anesthesiology as a post graduation that you would want to pursue? या ऐसा कुछ और भी
frankly
था?
speaking, medicine was my first choice.
Okay.
General medicine, because my grandfather,
हाँ.
he was in JJ से उन्होंने MBBS किया था, and हिंदू कॉलोनी में उनकी खुद की क्लिनिक थी. So he's, I mean, more than 60-70 years की practice थी उनकी. I mean, he practiced till the age of 84. So I would see that my grandfather was so good at his clinical acumen, clinical skills. So बचपन से मुझे वो बहुत, I was in awe of that. तो मुझे यही था कि मुझे मेडिसिन करना है, मतलब मुझे उनकी तरह बनना है. नाउ ऑफ कोर्स दैट टाइम थोड़ा सा मार्क्स में कम ज्यादा ये था, एंड AMO-ship came into, about AMO-ship.
No.
What happened is there's something called as AMO-ship which we had to do. So 1 year rural.
अच्छा.
अगर आप वो करके आओ तो that adds on to your marks maybe.
Okay.
Or it adds on to your whatever. And you would probably get into the next list whatever you wanted.
अच्छा.
But then I thought of not that it wasn't that if I don't get medicine I'm not going to do anything. So what I did is I put anesthesia as my second choice.
Okay.
Because anesthesia में lot of medicine is involved. There's a lot of physiology, lot of medicine. तो ये सोच के मैंने anesthesia डाला और मुझे मिल गया. तो since I got it, I was happy taking it up. And my cousin, I talked about 11 of us.
Yeah.
So one of them is a doctor herself. She's practicing in New Zealand now. She was already into anesthesia.
Okay.
So then I talked to her. I said, so she gave me quite a good positive feedback. वो anesthesia कर रही थी सायन हॉस्पिटल में.
अच्छा.
तो अच्छा feedback था तो I took it up.
So you did your PG from
I did it from GS Medical College and KM Hospital.
That's great. But how was your experience as an anesthesiologist in your early days?
You mean as after I qualified? Yes. Or during my residency?
During your residency.
Residency again, KM was, सुना था हमने कि बहुत वहाँ पे we were from a private medical college, undergraduate. So आपको they'll just treat you like अरे ये तो प्राइवेट के बच्चे हैं वगैरह, बट ऐसा कुछ भी नहीं था. We had excellent seniors and they taught us also. I mean, there was no differentiation there, at least and probably it was like, okay, we were sincere, we were doing our work. So it was a beautiful experience at KM. I mean, see, whatever I am today is the credit goes to my teachers at KM. Absolutely. So even now when I meet them, I mean, I'm always that nostalgia is there. Rather sometimes we all decide and we go for a conference so that we can just
meet up,
get together and be there. So it was a very, very good experience at KM.
All right, ma'am. Do you remember your first time being in the operation theatre? How was it like?
Well, I mean, don't have a very exclusive memory, but it was our surgery posting, and I think the first surgery that I saw was hernia. So yes, we were excited that day because OT clothes पहनने हैं, we had to change, cap mask and all that. So you felt a little important and nice.
Yeah.
And only मेरा एक ही memory है कि one in the group just had a fainting attack. So I remember that. But she was okay. I mean, within minutes, she was okay. But yes, so that was one memory that I have. Otherwise...
And even in anesthesia as a post-graduation, when you entered it.
Yes.
उस टाइम पे फर्स्ट जब आप पहली बार गए थे
राइट,
वो याद है क्या?
हाँ, वो याद इसलिए क्योंकि मुझे पहला मेरा एडमिशन हुआ नायर हॉस्पिटल में.
ओके.
Now as the list shifts up, as people start getting and as मेरा 11 दिन के बाद I got into KM. Okay. Because there are certain people who leave, take up the seat. So this way I got promoted and I got into
second
KM.
round में.
हाँ, second round you can say. But वो पहला दिन नायर में थोड़ी सी मैं मतलब I wanted KM because yes, my better half had got into KM.
Okay.
And that was one. And of course, नाम तो जीएस मेडिकल का बहुत सुना था कि it's one of the premier institutes, and to pass out from there would have been like a big thing. So I used to pray every day, oh, I hope the list shifts and I get there, and I got it. But my first day at Nair was in the Nair OPD, and thereafter in the recovery. So recovery of Nair was having ventilators and all. That was a post-anesthesia recovery. So I still remember that senior of mine. I don't remember her name, but now I acknowledge her now also when I meet her in conferences. कि आप मेरी पहली senior थी. तो because she on day one only she tried to tell me, you know, कि बेटा ये पोस्ट ऑप रिकवरी है एंड यहाँ पे पेशेंट्स ऑपरेशन थिएटर के बाद यू नो जस्ट दे गेट शिफ्टेड हियर, तो आपको सबका पल्स बीपी देखना होता है, and she just introduced me to that machine which was the ventilator. So I still remember her, and she really made me very comfortable that day, so I'll always remember her for that.
So that your first day was in Nair?
Yes.
Acha.
And then I came to KM.
Only one day at Nair?
No, 11 days.
11 days you were
उसके
at
बाद second list लगी, तो मेरा KM में नाम आया, and I shifted here.
Okay. But you found a change in the teaching and stuff?
हाँ, मतलब 11 days में तो ज्यादा कुछ वहाँ exposure नहीं हुआ मेरा. यहाँ पे yes, मतलब यहाँ पे तो we had excellent OT in charges, strict. They were strict, but at the same time they were very motherly, and they would take care of us. वो एक बहुत अच्छी बात थी anesthesia में कि lunch पे सबसे पहले आपको रिलीव करना है JR1s को, तो वो एक बहुत अच्छी बात थी.
तो आप लोग जल्दी रिलीव हो जाते?
बिल्कुल. और हमारे जो सीनियर मोस्ट ओटी इंचार्जेस थे, वो डांटते थे हमारे लेक्चरर्स को अगर हमें रिलीव नहीं किया जाता. अरे पहले उनको क्यों नहीं भेजा, you know, that way. So that culture was there at KM.
That was just to make you comfortable? Yeah.
Probably. So, but what I like about that is, Tanya, कि that same thing has come in me. तो मेरा अभी तक when I as an OT in charge, मैं सबसे पहले मेरे JR1 को पूछती हूँ कि खाना खाया बेटा, because I don't want anyone starving, and you can't give anesthesia when you are not fit to give, ना. I mean, you cannot be hypoglycemic, right, and thought process ही नहीं चल रहा है और आप anesthesia देने चले हो. तो मैं सबसे पहले अभी भी मेरे JRs को पहले पूछती हूँ, breakfast करके आए हो, नहीं आए हो तो जाओ, I can manage. So you know that way. So that culture is there. And of course, we had a lot of immediate, you learn a lot from your immediate seniors. Like you have your DA qualifieds, you have just post MD लोग भी थे, तो उनसे आप bedside बहुत कुछ सीखते हो, बहुत कुछ. तो बहुत सारा teaching patient के ऊपर होता है, right, rather than books. Books तो पढ़नी ही है, there is no doubt about it. I mean, every field has its Bible, and I think we should follow it. But there is a lot to learn from your seniors. And from your colleagues. Bedside, I mean, bedside. Practical job. Yes, yes.
That's a good thing. Were there any early challenges in your career, in your own medical journey?
Challenges as in, you mean getting into?
No, while you were doing post-graduation, did you come across any challenge that, this is something new to me, how do I go about it, या कैसे इसको face करूँ?
See, as far as you talking in terms of patients?
Could be, yeah.
So that's what I'm saying. You're so well protected when you're a resident कि आप किसी भी चीज के लिए आप directly responsible नहीं होते. Okay. Now we had some wonderful surgeons there, and one of them was my husband's teacher also. So certain units, उनके यहाँ, you know, we used to do some very superb surgeries, like insulinomas or pheochromocytomas. Yes. So that way back in 1997-98. So there was one unit, बापट सर की unit थी जो ये काम बहुत ज्यादा करते थे. तो उस टाइम कैसे था कि एक ही चैलेंज था, भाई ओटी में जल्दी पहुंचना है 7:30 बजे और सब प्रिपेयर करके रखना है. बाकी केस की टेंशन इतनी हम पे नहीं थी.
So as a junior resident उतना ही मतलब.
Yes, and of course एक था कि अपने साथ जो भी है, तो आज किसका टर्न किस कटिंग के लिए है. So that was one thing that of course the senior used to decide. कि आज इंट्यूबेशन इसको मिलेगा, आज रेडियल लाइन इसको मिलेगी या सेंट्रल लाइन इसको मिलेगा. सो दैट वाज आल्सो क्वाइट सॉर्टेड आउट कि कौन से लेवल के लिए कौन सा प्रोसीजर मिलेगा. दैट वाज आल्सो sorted out there. Previous day there used to be a sort of a small when we used to go and see the patient, you are supposed to come and give the over to your in charge. And so then she will itself, I mean कामत मैडम हमारी थी ओटी इंचार्ज वहाँ की, तो मैडम का तो एक बुक था, मतलब I just love that book and even now I feel like asking her कि आप वो बुक मुझे दोगे क्या, because every case के बारे में उन्होंने एक पैटर्न, मतलब एक प्रोटोकॉल लिख के रखा था. So madam would just she would update us कि इसके लिए आपको ये रेडी रखना है. So that was the teaching at KEM. तो हर चीज का एक सेट प्रोटोकॉल था,
SOP फॉलो होता था,
SOP sort of a SOP. So then things, so though it used to be a challenging case, things were made smooth from a day prior only. And like I said, we had very supportive seniors. So there were a couple of them who would come early with us and कि बेटा ये हुआ कि नहीं, वो हुआ कि नहीं, ऐसे. She would do the checks before the final authority walks in.
Right. So this kind of an environment also helps you like in your career further because you've imbibed that.
Yes. तो आज की डेट में भी मैं हमारा अभी क्या है, व्हाट्सएप आ गया है. तो अगर केस कोई लेट भी पता चलती है, आई मेक अ लिस्ट ऑन दैट ग्रुप कि 1 2 3 4 5 दिस चेकलिस्ट हैज टू बी प्रिपेयर्ड एंड केप्ट, सो दिट्स इजियर फॉर द रेसिडेंट्स. And then morning, there's not much of shouting and there's not much of everything chaos. There's no chaos and everything goes smooth. So
because that was followed.
Yes.
For someone who doesn't know about this field, could you please tell them what does an anesthesiologist actually do in an operation theatre?
Okay. Now you are about to undergo a surgery. Okay. So you're going to have cutting done on you. You're going to have a knife which is going to cut open something.
Yes.
Now that has to be without pain. Okay, that has to be without awareness. That has to be without any other effects of surgery. So anesthesia, what an anesthesiologist does is he is going to give you a pain-free surgery. Okay, and he's not all surgeries you will have a general anesthetic. Okay. Now anesthesia broadly is of two types. There is general, there is regional. Regional as in जहां आप एक बॉडी का एक पार्ट आप एनेस्थेटाइज करते हो, और जनरल में आप पूरा बेहोश हो जाते हो. नाउ आई एम स्विचिंग ओवर टू हिंदी बिकॉज आई मीन इट्स जस्ट फॉर दैट एवरीबॉडी टू अंडरस्टैंड. सो जनरल एनेस्थीसिया में भी कैसा है कि एक इंजेक्शन मैंने दे दिया और आप सो गए और बस बात खत्म, मैं वहां बैठ के न्यूज़पेपर पढ़ूंगी, ऐसी बात नहीं है. बिकॉज वंस आप बेहोश हो जाते हो, आपकी सारी चीजें मेरे हाथ में है. तो आपका रेस्पिरेशन, आपका हार्ट, आपका ब्रेन, ऑल दीज आर 3 मेन ऑर्गन्स, एवरीथिंग, किडनी, योर इवन यूरिन आउटपुट. लंबे सर्जरी के लिए हम यूरिनरी कैथेटर्स भी डालते हैं क्योंकि हमें वो भी देखना है. ऑल सिस्टम्स हैव टू बी वर्किंग इन दैट बेहोशी की हालत में. तो एंड इट्स नॉट जस्ट दैट यू डोंट हैव टू मूव, यू डोंट हैव टू बी अवेयर ऑल्सो. अगर मैं आपको सिर्फ एक बार पेन किलर दूं और बात वहां पे खत्म नहीं हो जाती. मुझे आपका एनेस्थीसिया, अगर सर्जरी 4 घंटे चलनी है तो मुझे 4 घंटे वो एनेस्थीसिया मेंटेन करना है, कीपिंग एवरीथिंग स्टेबल.
राइट.
So there are lot of, I mean there are medications involved which take care of each aspect of your physiology, right? And after all this is done, I have to get you back. क्योंकि बेहोशी की हालत से आपको मुझे वापस अवेक करना है, तो उसके लिए भी मेडिसिन्स अलग हैं. ओके, इवन दे हैव टू बी यूज्ड वाइजली. इट कैन नॉट बी दैट. सो एवरी डोज ऑफ एनेस्थेटिक इज बेस्ड ऑन योर वेट. एंड सेम थिंग if I'm giving you a regional anesthetic, मतलब आपको मैं अगर सिर्फ हाथ का सर्जरी है, मैं आपको सिर्फ इधर का ब्रेकियल प्लेक्सस ब्लॉक दे के भी कर सकती हूँ. पैर का है तो मैं स्पाइनल एनेस्थीसिया दे सकती हूँ. तो इन दैट पेशेंट कैन बी टॉकिंग टू मी. बट उसमें भी देयर आर सर्टेन पेशेंट्स हु आर लाइक कि मैडम मुझे कुछ देखना नहीं है, मुझे कुछ महसूस तो नहीं करेंगे, बट मुझे maybe memory नहीं चाहिए या मुझे put me to sleep. So there again I can give you some sedation also. तो मैं आपको सुला भी सकती हूँ उसमें. तो again same thing, मतलब एनेस्थीसिया चाहे जो भी हो, आपकी फिजियोलॉजी उसमें ऑल्टर होनी ही होनी है, और वो ऑल्टरेशन मुझे कंट्रोल करना है और मुझे मॉनिटर करना है और आपको सेफली उससे बाहर निकालना है. So that is
the basic crux of what an anesthesiologist does.
Right.
मैम, जो anesthetics यूज होते हैं
जी,
जो commonly यूज होते हैं, जैसे फॉर एग्जांपल स्पाइनल में ब्यूपीवाकेन है या लिग्नोकेन वगैरह यूज होता है, उनका बेसिक मैकेनिज्म आप बता सकते हो कि एग्जैक्टली होता क्या है पेशेंट के साथ?
See, local anesthetics act at the nerve level. Okay, general anesthetics act at the brain level.
Okay.
So that's on a gross this thing. Now that absorption is happening through blood, and then the brain levels are achieved. Okay, medications they you have to achieve. हमारे शरीर में ब्लड और प्लाज्मा होता है, तो प्लाज्मा लेवल्स जिसको हम बोलते हैं, सो सर्टेन आईवी ड्रग्स जो हम देते हैं उसका प्लाज्मा लेवल्स अचीव होने के बाद पेशेंट उसी लेवल ऑफ एनेस्थीसिया में रहता है. एंड देयर आर गैसेस, सो द ब्रेन लेवल्स एंड द प्लाज्मा लेवल्स हैव टू बी they have to be sort of maintained to maintain the anesthesia. So when the surgeon is finishing, I have to, so that's why you have to be in tandem with your surgeon. You have to be in coordination with him. So when he's finishing and I give him I give my patient the last dose, then I have to wait for 1 more hour for him to come out. So you can't do that. You have to be absolutely in sync with what they are doing, and towards the end of surgery, at the right time, you're supposed to switch off the gases. You're supposed to not give your last dose of medication. Like, to keep the patient still, we use one group of drugs which are muscle relaxants.
Right.
तो muscle relaxants मैं last में दे के, और अभी surgeon का last suture है और मैंने muscle relaxant दे दिया, तो फिर मुझे बैठना है वापस उसको बाहर निकालने के लिए. I have to wait now. So then that is what is it. You have to be very much in coordination with your surgeon. And at every step of surgery, it's going to be different. So there are certain times during the surgery where I might have to deepen the plane further. I might have to give extra dose.
Okay.
So all these things are happening during surgery. So it's a very dynamic thing.
So it depends कि क्या कैसे surgery progress कर रही है.
Yes.
And that's how you.
किसी भी crucial point पे I have to see to it that, oh, is it time for him to come out of the the effect of the relaxant? Then I cannot let that happen. I cannot let the patient move while the surgery is on. So that's where you are important. I mean, as an anesthetist, you're very, very vigilant, and at the same time, so you're playing with those drugs, you're playing with so many things at a time. Okay, and because everything you're doing, but not at the cost of physiology again. You have to maintain that as well.
Yeah.
So sometimes it's a tough job because yes, some surgeries are challenging. That's where it becomes a little, you're on your toes all the time.
But that's what's exciting, na, about anesthesia.
Absolutely.
Can you explain what happens when a patient is about to undergo a surgery? How do you prepare them for surgery?
Right. Now, as with any surgery, जैसे पेशेंट सर्जन के पास जाता है कंप्लेंट लेके, once it's decided कि आपकी सर्जरी करनी है, the next thing that naturally comes into picture is the anesthesiologist. So there is something called as a pre-anesthesia checkup or a pre-anesthesia assessment that we have to do, because surgery may be just maybe there's a small lump here, say a fat lump or a lipoma on the hand. So for the surgeon, it's a very small thing. But for me, I have to anesthetize him, whether it's GA or whether it's just a block or whatever I'm going to do. I must know him in and out because I have to know his comorbidities. I have to know what medications the patient takes, because there are certain medications which will affect my anesthesia.
Right.
Then I have to know any allergies, very important. Because देखो, anesthesia आप once in a lifetime लोगे, maybe twice. Okay, you've never been subjected to it before. Like आप कोई पैरासिटामोल खाते हो, वैसे आप ये दवाइयाँ तो नहीं ना, we are not exposed to them. So I have to know history of allergies in the patient, And definitely, once I know the comorbidities, I can stratify the risk. So that's again it's a huge topic, a pre-anesthetic assessment. So because there are lots of risk stratification tools, and we have a lot of indices. So, but that all that is important because I can talk to my patient accordingly. So I have to sit and talk to him. I have to talk to the relatives. I have to involve the family if it's really a high risk case, because sometimes patients have a lot of questions. So you let them ask all your questions, all the doubts, questions, everything. Then I have to assess also. I have to assess his airway. I have to assess the back if I have to give a spinal. I have to ask if he has had any surgeries in the past, and during those surgeries, if he's had any problems. So then I can avoid that particular thing, So pre-anesthesia check is one where you will not only know about it, you come to know your patient, that how anxious he is. So allay his anxiety. Let him know that it's not all dangerous. You are in safe hands. You have to make him realize that you are in safe hands, and definitely things get much better once they come on table. And of course, informed consent. That's one big thing where you have to, whatever the risk, you should never, the major facts, don't hide from your patients. You tell them what it is, you tell them what your risk is, okay? And there's always a way of telling it. You don't have to, at a gunpoint, you don't have to say कि ये ऐसा ही होने वाला है. ऐसा नहीं होता है. It is like, you have to always give them a statistics. कि ऐसे surgeries में इतना एक्सटेंट तक हो सकता है. आप हो सकता है 95% में आ जाओ, उस 5% में आप नहीं भी होंगे, बट 5% में ये होता है, ये मेरा आपको बताना ये काम है, ये इम्पोर्टेंट है. So never hide from them, and accordingly you take the informed consent from them.
So this is the basic workup that you have to do before.
And relevant blood investigations, relevant, you might have to make references. He may be, following up with a cardiologist for many years. अभी 2 साल से उसने देखा ही नहीं अपने cardiologist को, तो उसमें आप उसको समझाओ कि एक बार आप दिखा क्या. Because surgery and anesthesia are stressful conditions. So कैसा है, चलते फिरते बंदे को सब ठीक ही चल रहा है, but once they come under that stress, how he will react, how his BP will go up, that you can never predict. So you might have to take references from the specialists. So basically a multidisciplinary team approach when it comes to high risk cases, when it comes to little elderly patients with comorbidities. So that's important.
Okay, ma'am. So what do you do if something unexpected happens while the surgery is going on? Have you ever had to deal with such kind of a situation?
Yeah, once in a while you do face such situations where just suddenly out of the blue something happens. First and foremost, maintain your calm and call for help, because many a times the answer is right there. Like say sometimes it happens that suddenly the ventilator stops, but why it has stopped? So simple things like check for disconnections. So before going to something major, you first do all your checks. You might just see a straight line on ECG, but that's not actually a straight line. It's a disconnection here. Okay. And yes, if an event has really occurred, you go by protocol, you do your best. Okay. You call for help, you call in people, and if you do the right way, things always go the right way. All right. So it's not like it's not the end of the story, or it's not that way. You have to do your best in that situation to save your patient. So like we have protocols. So you follow protocols and accordingly go ahead. It might be, it might be anything. It might be maybe an electrolyte problem. So it's going to be in the OT you have help. Most of the times somebody's there who will come from the next OT. So it goes hand in hand. Like one person is looking after one aspect, the other person looking after the other aspect. And we have faced, because we have had massive blood loss. We've had sometimes a cardiac arrest. Very rare, but it can happen. So again, instead of panicking, the first thing is call for help. Get all your things in place. And if you go in a protocolized manner, things, you can definitely save your patient.
You mentioned cardiac arrest. That's what we, in medical language, we say the patient has crashed.
Right.
So we usually perform CPCR or CPR
Right.
as the common public knows about it. It's a basic life-saving skill that every individual should know.
Very true.
Could you please briefly explain about CPCR for the audience?
All right. Now, CPCR again, what we talked about OT scenario, now that's totally different. But for common man, if you see a patient collapsed, the first and foremost thing that you're supposed to do is activate emergency systems, call for help. Any passerby, call for help. Okay. If you are in a mall or an airport, you can ask them to get the AED. Now, you've just seen somebody falling. As a healthcare professional, you and me, we could just, in 10 seconds, you could assess whether he's breathing and whether he has a central pulse.
Right.
People often start looking at this. There's no point, because if it's an arrest, you're not going to get this. And by trying to palpate a peripheral pulse, आप जब peripheral मतलब यहाँ की pulses जब देखते हो, आप time waste कर रहे हो.
Okay.
क्योंकि तो उससे अच्छा है आप call for help, activate EMS, or the best you can do for that patient is at least start chest compressions. मतलब एक बार आपने देखा कि patient not responsive, आप उसको shoulder पे tap करोगे ना, जब जैसे patient गिरता है, आप पूछोगे कि भाई are you all right? So these three things you've done. Once he's not all right, he's not responding. If you can gauge not breathing, pulse feel होता है नहीं होता है, you can start a chest compression. और chest compression कहाँ पे देते हैं? जो हमारा sternum bone होता है बीच का, breast bone जिसको common man कहता है, उसके lower half में आपको अपने heel of the hand से okay, lock your hands and with the heel of your hand you start compressing the chest. The whole point is कि अभी आप अगर healthcare professional नहीं भी हैं तो आप mouth to mouth breathing शायद नहीं दे पाओगे, या आप mouth to mask. Now I am an ACLS provider. If I have a pocket mask, I should do it. But if people don't want to do it, that's okay, because for hygiene purpose, they may not be wanting to do it.
Right.
But at least start compressing the heart or doing this chest compressions, because in the first few minutes जब patient आपके सामने गिरा है और arrest है, तो उसमें there is still oxygenated blood in the body going. तो आप जब ये compression देते हो तो आप क्या कर रहे हो? आप heart को breast bone और vertebral bone के बीच में उसको press कर रहे हो to eject that blood out. So अगर आप वो भी नहीं करोगे तो जो बचा कुचा chance है वो भी गया. So start that chest compression, which is what we also call it as compression only CPR, which is taught to many, you go to schools, you go to so many places and you can teach this.
Okay.
That the ideal way is, yes, once you have healthcare providers and all, you should do 30:2. That you and me would know that.
Yes.
But common man doesn't know it. So at least start compressing at least 100 to 120 per minute. Utna. And like I said, if you're at an airport or if you're in a mall or many prominent places now have something called as AED. That is an automated external defibrillator. तो AED में क्या है? The beauty of AED is आपको सिर्फ power on करना है और AED सारे prompts देगा आपको. तो common man भी use कर सकता है वो.
Okay.
तो apply the pads. Okay, then stand clear. तो stand clear means you cannot touch the patient when the AED is going to. तो अगर shockable rhythm है तो AED आपको बोलेगा कि stand clear and it will shock the patient. So that is where you have seen the patient arrest, and or even if you've not seen and you're called at the scene, at least this much you can do before the healthcare providers arrive. So this is what I would like to tell the common people, that if you see someone, at least start chest compressions. You like I said, you may not be comfortable giving a breath, giving a mouth to mouth or a mouth to nose. In a child, you can give mouth to nose, but at least start doing this.
It's very important skill that
each one of us should have.
Yeah. All right, ma'am. It's just it's a different question actually. Do you think technology has changed an anesthesiologist's job over these years, or I mean, has it become easier for you because of technology now?
Definitely. I mean, my teachers will always say, girls, you're born in a very good era, that you have so much, that way.
Yeah.
Because when my teachers have used open ether techniques and all. Now, we didn't have to use open ether and all that. But forget even going back that much. Just from my residency to now, so maybe 27 years, 28 years, today I have everything at my one station, like I have my respiratory gas monitoring there, I have my pressures, my ventilatory pressures are being monitored, BP, pulse, saturation, मेरा सब कुछ एक ही इसमें मेरे head end पे मेरे machine पे आता है, which was not so 30 years back.
Right.
मतलब जब हमने शुरू किया तो very basic systems were there, very basic machines were there. So now those machines have come with all this incorporated in them. And they are called as workstations now. So those anesthesia machine is now anesthesia workstation. So workstation mein, like I said, like pura respiratory gas monitoring, ventilatory pressure monitoring, all my ventilator, the ventilator itself, I have a lot of different modes of ventilation on an anesthesia ventilator also. पहले था कि सिर्फ वॉल्यूम कंट्रोल पे हम कर सकते थे, बट ऐसा नहीं है. आई हैव 3-4 मोड्स, आई हैव वीनिंग मोड्स. So, definitely technology has made a huge difference. But at the same time, what I would like to advise is, let not technology overcome you. And let not technology overcome your clinical skills. जो आपके clinical skills हैं, वो आपको जिंदा रखने ही हैं. आप lazy नहीं होना in implementing those,
right.
Because many a times machines can fail you, but your clinical acumen and your clinical knowledge can never fail you. Because so what I always tell the juniors also. I mean, so many times it happens. You catch them sitting on the phone. Why? Because iska alarm baj raha hai, uska alarm hai, activated hai, sab kuch. So you have to keep telling them. So I had a very good, training, hand on pulse. नाउ हैंड ऑन पल्स आप रखोगे तो क्वालिटी ऑफ पल्स से ही आपका ध्यान मॉनिटर की तरफ जाता है कि अरे सडनली माय पल्स हैज गॉन अ लिटिल लो, तो क्या हुआ, बीपी कम है क्या? सो दिस जस्ट अ सिंपल वन एग्जांपल आई गिव यू. सो दीज थिंग्स शुड नॉट गो आउट ऑफ यू just because technology has taken over. So make use of technology, but not at the cost of losing the clinical touch with the patient. So make use of, let both the best worlds meet, and you should be somewhere in the middle of that. Not just depending on technology, and not just not going back to the very age-old things also. So it has to be a mix of both. Absolutely.
I off record अगर मैं बोल सकती हूँ तो मैं ऑर्थो के ओटी में थी, and you walked in. Right. You said the same thing that you just mentioned, hands on pulse वाले, तब anesthesia वाले बैठे हुए थे, and I guess they were on their phone. तो आपने आके चिल्लाया, आप phone पे क्यों?
Absolutely. See, you cannot be on the phone, because let me tell you why that's important. Your machines have, all alarms have a lag period. हाँ. तो बच्चे में आप क्या करोगे? Lag period को till it detects and tells you. By that time, sometimes it could happen that the cyanosis is already there. So it's very important. मतलब आजकल usually वैसे नहीं होना चाहिए, but again machine is a machine.
Right.
Okay. So you cannot forget your clinical skills over your machines. That's what I always keep telling my residents also. Very important again.
Yes. After all that I have heard from you today, your job seems really demanding. How do you manage to balance work and personal life?
I from the beginning, I took up an institutional practice. Because institutional practice, one advantage is that yes, you have some time, you have some, at least to some extent, you have a fixed time.
Right.
Now, I have friends who are freelancing, and from morning till night they are busy. Now, I never wanted a job like that. I never wanted to do that way. Yes, probably there's more money in that, but now when you are raising a family, when you have children, when you have people to cater at home, I mean, we were always, even after marriage, I was in a joint family. I am in a joint family always. So I had old parents-in-law. And so, you know, to balance all this, I always thought it's better to have an institutional practice. So after a certain time, I'm at home. At least by evening, I'm at home. You know, just to know what my kids are doing, what's happening in school. Those days I'm saying. Now both of them are in medical school, but उस टाइम भी ये था कि एंड आई मेड इट अ पॉइंट, और एक फायदा ये था कि इंस्टीट्यूट में रह के आप whenever they wanted me to be there for their say projects hai, PTMs hai, I can take a leave from there and go there. So wanted to give them equally that much time, and because that comparison used to always be there, you know, मम्मा उसकी माँ लेने आती है स्कूल, आप नहीं आते, तो मैंने कहा जब आपको मम्मा की एकदम जरूरत होती है तो मैं होती हूँ. So you know, that way. So all their parents days, their sports days, I saw to it that I took a leave and I'll be there. So
you gave importance to personal life also, because right now in this era you see people, you know, in that rat race कि नहीं पैसे कमाना है, ये मुझे एक मुकाम पे पहुंचना है, लाइफ
मुकाम पे पहुंचना है, बिल्कुल.
So you miss out on family.
Absolutely.
And family time. But I think to have a balance is really important.
True. And of course you must have outings also with your family, because without that, then children won't make memories, right? You must have memories with your family as well. Work is important, but work-life balance is more important, I think. So,
right. It is really important. After handling such stressful situations in the operating theatre, what do you do to unwind and relax?
I love going for walks, even if I'm alone. That's one way of de-stressing for me. I like to go for a walk.
Okay.
That's one. I love listening to music. And पहले घर जाके after a very heavy day, like to have a nice hot cup of coffee or tea. It's mainly tea. It's most of the times tea.
Okay.
And थोड़े से, you know, I try to not think about the day. So then I'll speak to my mother. I'll just tell her about the day-to-day thing. And like I said, I love going for walks. So I do that after say 1 hour or so after being at home. Then I
do
go
you have
out
any
for a
hobbies?
I like listening to music. I used to like singing. I like singing.
Okay.
But couldn't do it. And I always tell my kids also that if I had not been a doctor, I would have been a singer.
Really?
मुझे बहुत अच्छा लगता है. मतलब I know my voice is husky. मुझे थोड़ा मतलब in school we had a choice between art and singing. Art and music. तो मैंने 8th 9th 10th में म्यूजिक लिया था.
Okay.
तो जो हमारे म्यूजिक टीचर्स थे, आई वाज फ्रॉम सिंघानिया स्कूल, एंड बड़े ही अच्छे थे. तो मुझे मैंने मेरी म्यूजिक बुक अभी तक रखी थी, मतलब कुछ सालों तक. अभी आई डोंट नो, आई जस्ट लॉस्ट इट समवेयर, बट वो गाने मुझे अभी भी याद है और मैं गुनगुनाती हूँ और गाती हूँ. और हाँ, मुझे अच्छा लगता है.
लाइक क्लासिकल या
क्लासिकल मीनिंग देन बीच में 1 साल मैंने हारमोनियम भी सीखा, बट वो परस्यू नहीं किया. तो उसमें क्लासिकल भी I don't know, Tanya. I'll have to try, or I'll have to just maybe practice it again. तो मुझे म्यूजिक पसंद है. तो that's what I said. Now, if I'm not gone for a walk or something, I'll sit and listen to some music.
Old songs या अभी के?
Old songs, yes. अभी के भी कुछ अच्छे लगते हैं, ऐसा नहीं है.
Nice. For people in any job, like stress handle करने के लिए आप क्या advice दोगे?
स्ट्रेस हैंडल करने के लिए देखो, आपको जैसा मैंने कहा, वर्क लाइफ बैलेंस ये बहुत इंपॉर्टेंट है. दिस इज अ पार्ट ऑफ आवर वर्क, व्हाट वी डू. ओके, इवन इफ यू फेस अ मिसहैप, इट्स नॉट द एंड ऑफ द वर्ल्ड. What at the end of the day, what you have to think is you've done the best for that patient. Okay, you have, so jo aapne kiya, have you done it to your best extent? That's one thing that you should think of. And once you go back home, don't think about it. Just don't think about it. क्योंकि ये हमारा प्रोफेशन ही ऐसा है कि ये कभी ना कभी हम फेस ही करने वाले. अगर आपने कभी मिसहैप फेस ही नहीं किया, मतलब आपकी प्रैक्टिस फिर आप इतनी की ही नहीं है आपने. अगर इतने सालों में आपने एक भी कॉम्प्लिकेशन देखा नहीं, तो so there's no need to you can just with your team you can sit and debrief that what went wrong or what happened. Okay. And after that I think in a very cordial manner you should be able to come to terms with it and not take any extreme step or something, because there are certain like we have colleagues who are very sensitive about so many things. So at the end of it, it's that what is important is, yes, you tried your best to do for that particular patient, and de-stress in whatever way you can. So either it's like, like I like listening to music, people like to dance, people like to go for outings, people like to go maybe for swimming. I mean, I have friends who like to go for swimming also. So it's whatever way you can, you should find some particular hobby or stick to that so that you can unwind
and keep yourself mentally sane.
Mentally sane. Of course, you have to be mentally stable, because next day you have to get up and give your best for the next patient.
Right. Yeah.
So you can't. If you're sad about then you take a leave for that day. But don't come in a disturbed state of mind to do your next patient. That's what I would say. एक दिन आपको थोड़ा डिस्ट्रेस और करना है, एक दिन छुट्टी ले लो, लेकिन अगले दिन you should be fresh, up and awake, welcoming the new day with new hope. And
right, that was a really great advice, ma'am. There are a few common man's questions that I would want to put forth. It will help with their मतलब उनका क्या, वो क्या सोचते हैं anesthesia के बारे में. So first question, what happens if I wake up during the surgery?
Now, generally, see, this usually will not happen. Okay, 99.99%. There are certain surgeries where we do wake up the patient. Now, there's something, now that you got this topic up, there's something called as an awake craniotomy. Okay, where particularly if the surgeon is operating on one very important area of the brain, as in the motor area of the brain. Okay, so अभी ड्यूरा ओपन होने के बाद ब्रेन इज इनसेंसिटिव टू पेन, ऑलराइट. तो पेशेंट को ऑलरेडी प्री ऑपरेटिवली हम काउंसल करते हैं. दिस इज अ लिटिल ऑफ टॉपिक दैट आई एम टॉकिंग, बट सिंस यू टॉक्ड अबाउट पेशेंट हैविंग दिस डाउट, ये मैं जस्ट बता रही हूँ आपको पेशेंट के नॉलेज के लिए कि देयर इज समथिंग कॉल्ड एज एन अवेक क्रेनियोटोमी, वेयर पेशेंट को हम अवेक एक्चुअली करते हैं ड्यूरिंग सर्जरी. कि when the neurosurgeon is at that particular speech area, तो पेशेंट को हम बात करवाएंगे.
Okay.
एंड पेशेंट बात करेगा. या मोटर एरिया है तो पेशेंट को बोलेंगे बेटा हाथ लिफ्ट करो, तो he lifts and shows. So now the neurosurgeon knows he's not near the area of the motor area of the hand, or he's not near the speech area.
अच्छा.
So this is one aspect. The other aspect what you're saying, generally ये नहीं होता है. Now this is surgery requires it to be done, so we will do it where the patient is already explained, the family is explained, and it is to be done. The other aspect where generally this will not happen, okay, unless something like your gases run out, I mean, and you've forgotten to see that you've not refilled it. So it's basically it's my shortcoming if my patient is aware during surgery. It's nothing to do with the patient. So मतलब अगर ऐसा गॉड फॉरबिड हुआ, तो कहीं ना कहीं हमारे मशीनरी में या हमारे सिस्टम में कहीं कमी रह गई थी कि मैंने वो डिटेक्ट नहीं की. Okay. And of course, so that's what I said कि anesthesia is all about vigilance. So we have something called as inhalational anesthetic agents. You know, those are the mainstay which keep you totally unaware during surgery. तो गैस लेवल्स दिखती है उसमें. Okay, तो अगर मेरा ध्यान नहीं रहा उस पे, I have to refill it. It's a long surgery. When will this happen? Awareness in a long surgery where I have forgotten to see this, I have forgotten to refill it, and पेशेंट को सिर्फ ऑक्सीजन जा रहा है. तो पेशेंट फिर सर्जरी के दरमियान अवेक हो गया दैट वे. तो like I said, maybe my vigilance was not that great and I didn't see that and I didn't refill it. Otherwise, awareness should not happen normally in any patient.
During the surgery. All right, ma'am. Next question. What are the side effects of anesthesia?
Now, side effects, it depends upon what type of anesthesia we have given. Okay. So, now certain things like cases which are done under spinal.
Okay.
The moment you give a spinal anesthetic, there is some physiological change in the body that brings your BP down. So that's bound to happen with anybody, whether it's a young man, old man, whatever.
Okay.
So that's a part and parcel of the effect of that
Anesthesia.
yes, of the anesthesia. But again, it can be very well controlled. Okay, there are certain things that we need to do and keep things ready to take care of that hypotension. So, I mean, this is just one example I'm giving you. And like I said, IV agents also have their own effects. Some cause little drop in heart rate, some cause a drop in blood pressure, some of them cause higher blood pressure. So all this, but it's well within my, once it's well within my control and I know how to judiciously use it, things don't go wrong. Momentary changes that happen in the patient are very well taken care of. So not like, and patient को वो पता भी नहीं चलेगा. मतलब patient will not be even aware of it that ये सब हुआ. ये चीजें जो हैं थोड़ी बहुत होती रहती है. Plus another thing, post-op nausea, vomiting. Now particularly when patient gives me history that मेरे पहले surgery में मुझे recovery area में बहुत ज़्यादा vomiting हुआ था. So then I have to be extra careful. So then again, maybe multimodal, I might have to use more than 2 drugs for taking care of his. And maybe next time when he comes to me, and if the case can be done under a regional block, I'll prefer that. I'll not give him GA.
Right.
So these modifications I can do. So as such, side effects means they are the effects of that particular drug or that particular maneuver that we will do during. But these are all momentary. They are not going to be permanent changes, and they are very well taken care of by the anesthesiologist right there and bringing you back to a normal physiology within seconds or minutes. So,
okay, ma'am. The next question: is it possible to have an allergic reaction to anesthesia?
Yes, of course. You may have. I have seen allergies to something like ranitidine. I have not exactly to my anesthetic drug. I'm not, so far I've been lucky not to see a major anaphylaxis with any of the drugs that I am using at the moment. There are certain people who have seen it. Now that is again, like I'm telling you, 1 in 4 lakhs, 1 in 2.5 to 4 lakhs maybe. So it's just unfortunate that you were that 1 in 2 or 2 to 4 lakhs. But otherwise, when patient has n number of history of allergies, what we do is again we pre-medicate with certain maybe steroids देंगे, maybe कभी-कभी antihistaminics भी देंगे, and then we go ahead with giving our drugs. So that we could do. But yes, now this जो unpredictability है कि suddenly किसी patient में कुछ हो जाए, वो तो it could happen.
But can we मतलब surgery से पहले can we know कि ये patient को allergic reaction हो सकता है कि नहीं? Could we do a test before?
Yeah, so allergy testing is done for antibiotics. It's done for local anesthetics. जहाँ 0.1 ml is injected intradermal and then they see. So if that wheel is more than 10, whatever we've learned before, so more than 10 mm, then you have to be careful. And many a times patient आपको बोलता भी है in your, that's why that pre-operative assessment is so important. तो pre-operatively अगर उसने मुझे बोल दिया है कि no madam, cephalosporins I am allergic to, or augmentin I had a severe allergy, you wouldn't even go near that drug. Okay, so something that's unpredictable, well, then if the event occurs, you have to be absolutely geared up to take care of that emergency and try to do your best.
Okay. Next question. What should I avoid eating or drinking before getting anesthesia?
Right. So before any elective anesthetic, okay, elective surgery, you're going to be given proper orders. So for any light meal, you need minimum 6 hours. Clear water, you can take 2 hours prior. Now, actually, it's clear liquid, but there are many a times where that clear liquid, patients don't understand. And मुझे बोला था कि खाओ नहीं, लेकिन आप पी सकते हो. तो मैंने चाय पी ली, madam. So chai is not a clear liquid, okay? So what we advise is, depending upon the educational level of your patient, you can always advise आप पानी पी सकते हो 2-3 घंटे पहले तक, 2 घंटे पहले तक थोड़ा पानी आप ले सकते हो. So 2 hours for water or clear fluid. Clear fluid is defined as something that through which you can read the smallest newspaper print. That is what is clear. So you could give, appy drink, you could give. But that's under supervision. If you're there in the hospital, you are in charge of that particular patient from your side in the surgical unit. So you could do that. और straight away give them clear instructions कि आप 6 घंटा पहले ही आप कुछ खा सकते हैं and 2 घंटा पहले थोड़ा पानी आप ले सकते हो. 2 घंटे पहले तक आप पानी ले सकते हो. And of course, if it's a fatty meal, what is said is like कोई patient मटन खा के आया है तो उसको ideally we should wait for 8 hours. A fatty meal you're supposed to wait for 8 hours. But in emergency this doesn't apply then. Something like emergency sections. So what do? You can't wait. So it's like if she's eaten, then the best thing is we will give some pre-medication so that she doesn't vomit, and we give regional anesthesia. So we give spinal there. That's where you have to take up in emergency.
All right. Next question. Will anesthesia affect my memory or cause confusion afterwards?
A momentary confusion, maybe. It all depends on, elderly patients do have some amount of cognition. Sometimes, not always. But there's nothing like a memory loss or something. No long-term memory loss. And repeated exposures, like there were lots of studies where repeated exposure in children, will they affect a long-term neurocognitive function and all. Again, the results are equivocal. So it's not like it's not been proved for sure कि ऐसा होता ही है. And see, all of us, once in a way, we require anesthesia. So that once in a way, what you require has no effect on your memory. Post-op confusion, for some time, maybe that's why that recovery area is important. So we keep all our patients in the recovery area. So post-op confusion sometimes could happen in some patients. But that gets, patients get over it very fast. It's not like long-term rahega aisa nahi.
Okay. Next, what is the recovery process like after anesthesia and how long does it take?
See, nowadays, because of advent of all the new agents, better drugs, better technology, better equipment, all this has led to an excellent recovery from anesthesia. Okay, so the drugs that we use now and the drugs that were used 50 years ago, there's a vast difference.
Right.
So they all the wash in and the wash out of these drugs out of the body is fast. Okay, so पहले कैसे था इन रिकवरी वी यूज्ड टू से कि 6 घंटे तक कुछ मत दो. नाउ अगेन डिपेंडिंग अपॉन सर्जरी, अगर कोई इंटेस्टिनल मेजर सर्जरी हो तो दैट पर्टिकुलर सर्जन माइट नॉट वांट टू स्टार्ट feeds and all early. That is okay. That's individualized, tailor made to that particular patient. But in general, एक स्ट्रेट फॉरवर्ड सर्जरी जो की है, जहाँ स्ट्रेट फॉरवर्ड एनेस्थीसिया दिया है, आपको 2 घंटे से ज्यादा हम नहीं स्टार्विंग रखेंगे. सिप्स ऑफ वाटर हम चालू करते ही हैं in 2 hours. Okay, where no contraindication from surgical point of view also. Anesthesia wise, definitely we don't require them to be really starving for long, because I said we have really good drugs. So जिनका मेटाबॉलिज्म भी फास्ट होता है, तो ऐसा लिंगरिंग नहीं रहता है कि पेशेंट 6 घंटे तक अभी सोया ही रहेगा. नहीं, ऐसा नहीं है. पेशेंट इज अप एंड अवेक, you can start sips of water in the recovery itself.
Last question. Can anesthesia affect my long-term health?
No. I mean, why? I mean, there are, now in this aspect, I have lots of ladies who have come to me saying that, Madam, आप पीठ में सुई देने वाले हैं तो वो तो मेरा बैक एक रहेगा ही ना आगे. या they will tell me बैक है तो आप मुझे पीठ में सुई मत दो. Now see, backaches in ladies or backache is something, it's a very vast topic again. The needle that we give piche is not into your bone or something.
Right.
It's between two bony. It's between the yes, between the it's in between the space between the two bones.
Right.
Okay, where the your spinal cord gets temporarily anesthetized.
Right.
So that has nothing, and it's hardly. It's I always explain to them that needle is even lesser than the needle that goes into your vein. So उसका और आपके बैके का कोई ताल्लुक ही नहीं है. Okay, so please remember that anesthesia per se will not give you any long term morbidity as such. Like I said, even for mentally memory bolo ya ye, not at all, because all these medications are quickly washed out.
Right.
Okay, they are not going to give you any long term effects. And same thing about regional blocks. Like even brachial plexus I give, patients may have कि अरे मेरा बाद में हाथ हिलेगा. Of course हिलेगा, because the local anesthetic is around your nerves. After some time, it's going to get metabolized. It's going to go out of your body, going to be excreted out. So don't worry, it's not going to have any, unless I've damaged a nerve while giving the block. So sometimes you can have a neuropraxia sort of thing. But now again, with the advent of ultrasonography, we give ultrasonography guided blocks. तो वो प्रॉब्लम नहीं आती. पहले हो सकता था वे ब्लाइंड ब्लॉक्स वर गिवन, कि आप नर्व में ही वो नीडल चली गई है, बट अभी वो नहीं है, बिकॉज एवरीवेयर, ऑलमोस्ट एवरीवेयर, ऑल इंस्टीट्यूट्स, वी आर यूजिंग अल्ट्रासाउंड गाइडेड ब्लॉक्स, सो शुडंट हैपन.
सो रिस्क काफी कम हो गया अभी.
एब्सोल्युटली.
ओके मैम, so if someone is thinking about becoming an anesthesiologist, what would you tell them about the job?
Yeah, I would always, I would encourage anyone to take up anesthesiology because, first of all, you have a knowledge in total about everything. Okay. Right. And your medicine and physiology has to be strong when you're taking up this as a career. Plus, इसमें ज़्यादा investment नहीं है, Tanya. You're not like, see, for a surgeon, he has to think, no, he might have to put up a hospital or something. For an anesthesiologist, आपको इतना मतलब आपको इन्वेस्टमेंट एज सच कुछ नहीं है. यू क्वालिफाई, यू गो, you have job opportunities. Even surgeons also do have job opportunities, but when it comes to surgical branches, it's mostly like, they want to put up their own nursing homes. Right. Or kahan pe, and the more you specialize, the more difficult it is, in the sense, to start off. Right. Once the career, once you just kick it off, it's fine. But at the beginning, but for an anesthesiologist, I think even as a starting as a career also, it's not that difficult as it would be for a surgical branch. And besides this, there are, see, anesthesia itself has a lot of super specialities now. Okay. So you can finish your MD and you can go on to do cardiac or pediatric or neuro. So neuro anesthesia, transplant anesthesia has come in a big way. Onco anesthesia has come in a big way.
So there are different super specialties.
Yes. And now with the current scenario, we have, if you know, we have specialized institutes also. So we have cardiac institute, we have onco institutes, where this job will always be in a demand. Okay. So anesthesia as a career, I think, it's a very good branch, and you have many options after that. So it's not like you just stop with your MD. Okay, you can go on to do even pediatric anesthesia. So once you're specialized, then you're absorbed into that. Even in your corporate side, corporate hospitals like people who have extra fellowships. So definitely they're absorbed very fast, yeah, in these places.
I read, while reading about the ratios of anesthesiologists versus general population, during 2018, it was around 1 anesthesiologist to 1 lakh population.
Exactly. आप interiors में जाओगे तो नहीं है anesthetist. So this job is ever demanding. I mean, it's not going to die because see, you can't carry out a surgery without anesthesia.
Right.
So जितने institutes नए नए आ रहे हैं उसमें हर जगह आपको anesthetic की तो जरूरत है ही.
अभी तो फिर भी recent जो ratio थे, it was 2:1 lakh, मतलब एक anesthesiologist to 50,000, which is still it is getting better, but not up to the standards.
Not up to the mark at all. Absolutely.
And that disparity is even more in rural areas because वहाँ पे I think because वहाँ पे facilities available नहीं है तो anesthesiologist वहाँ जाकर भी क्या करेगा?
Exactly. So government has to do something about making all our rural facilities better. Right. Then people will go and stay there. Because there are so many people, मतलब मेरे साथ भी जो बैचमेट्स थे बहुत सारे या जो इंटीरियर्स में रहते हैं लेकिन फाइनली सेटल हुए हैं थोड़ा इस तरफ आके
urban cities.
So many have not gone back to maybe Jalgaon या not gone back to their native places, but they've come to urban cities and settled. So here I think government needs to do something because yes, rural areas में literally there is like one anesthetist who has to cater to that entire गांव के लिए. तो वो भी अच्छा नहीं है. If that is improved, then probably this particular ratio it will narrow down.
Yes, ma'am. So also I think anesthesiologists अगर ज़्यादा हो जाएंगे rural areas में तो infant mortality and maternal mortality rates भी काफी नीचे हैं.
बिल्कुल, that's a very pertinent point because if what happens is as an anesthetist now if the pediatrician hasn't reached, I can at least help in resuscitation of that neonate.
Right.
You know, it makes a difference because we have the airway skills. So if you are there at the scene and your pediatrician hasn't reached, आप कुछ तो उस बच्चे के लिए कर सकते हो. And जैसे मैंने कहा कि medical knowledge आपको थोड़ा ज्यादा होता है बाकियों से, तो आप वो अप्लाई कर सकते हो किसी भी फील्ड में, मतलब सिचुएशन में.
Also अगर कोई फीमेल को नॉर्मल डिलीवरी नहीं हो रही है and she has to be taken up for C-section, you need an anesthesiologist for that. And वो भी will help in reducing the maternal mortality rate क्योंकि उसमें तो and infant mortality rate as well.
Very, very true.
Yeah. Also, do you think there's some kind of a personality as skills you need to become an anesthesiologist? Some kind of a mindset that you need?
Mindset, see, you have to be quick in your reflexes. Okay, you have to be absolutely vigilant and you have to be ready to work for long hours. See, even now at this stage, if the surgery and the patient demands that I need to be there, I have to be there. So ये नहीं कि मेरा 9 to 4 जॉब है तो मतलब 9 to 4 ही मुझे
काम करना,
वो नहीं है. आपका पेशेंट अगर if it's a supra major surgery, there is blood loss going on, there is a lot of hemodynamics going up and down. I mean, I'm not going to leave my case and just walk out, right? I'm going to be there or until I have my level, some reliever is there who can take over the case. Suppose it's really gone on for long. So you have to be prepared to work for long hours. You have to be prepared to work under stress. I mean, it is a stressful job. And yes, you have to be vigilant all the time. I mean, vigilance is something that goes hand in hand with an anesthesiologist. There's no replacement for that.
This is a good time for you to debunk the myth that anesthesiologists just sit down there and phone chalate ya newspaper padhte hai.
Yeah, absolutely. I mean, I hope after this conversation, the common man knows how important the anesthesiologist is.
Yes.
And ये भी पता होना चाहिए, it's a separate degree, it's a separate super specialty and with super specialities now. Okay, so it's not a technician's job at all. मतलब मैं मेरे टेक्नीशियन को सिखा सकती हूँ कि स्पाइनल कैसे देना है, लेकिन स्पाइनल का साइड इफेक्ट्स मैनेज करना उसको नहीं आएगा, वो मुझे ही करना है.
राइट.
आप किसी को भी हाथ पकड़ के आप ब्लॉक भी सिखा दो तो कल 10 दिन के बाद वो भी देने लगेगा, लेकिन उस ब्लॉक के बाद क्या होता है, पेशेंट में क्या चेंज हो रहा है, वो तो वो नहीं मैनेज कर पाएगा ना. सो इट्स नॉट अबाउट anesthesia is not about just one injection. It's many things. I mean, the airway management. Now, we didn't talk about all that, but there are lots of things. Airway management itself it's an array of gadgets. It's an array of so many things. I get a patient who every time doesn't have a good mouth opening. I get a patient who's just having, a cancer inside.
Right.
Mouth band hai. मैं intubate कैसे करूँगी? So there are different ways to do it. So I mean, it's a absolutely it's a dynamic branch. It is definitely having lots of challenges, and you have to face. I mean, many times you have to face situations just out of the blue. It's like a bolt from the blue.
Yeah.
Like you asked me in prior that what happens when a mishap occurs. Sometimes you're just taken aback because everything's going on smooth and what went wrong. So again there, protocolize. You start with the simple things. A quick check. Ye hua, ye hua, ye hua. So again it comes back to being vigilant and being complete in your knowledge about whatever the patient is suffering from, whatever his comorbidities. Because many a times things may be related to what he had preoperatively and that may be related to what went wrong inside. तो ये सब आपको बहुत ही अच्छे से पता होना चाहिए to become a good anesthesiologist.
Yes, that is extremely true, ma'am. Okay, ma'am, let's do a fun round now. Can you share a funny, surprising moment that happened during the surgery or while the patient was waking up, maybe?
Well, one I remember was in the OT. A young man, we had finished and थोड़ा ना towards the end of surgery उसको थोड़ा ketamine मुझे देना पड़ा. सर्जरी थोड़ी प्रोलॉन्ग हो गई, स्पाइनल वेयर ऑफ हो रहा था, तो ketamine, तो I mean ketamine causes a bit of hallucinations. So when he was coming out, he's like, oh, where's that beautiful lady? I want to thank her. And a little bit he became, so that was a bit, all my residents looking at me and so that was long ago, but this had happened. So everyone
don't mind me asking, but you felt good, na?
I mean, when you're complimented, yes, you feel good about it. But it was funny. I mean, the way he was talking and कि एकदम intoxicated जैसे.
That must have
so
been
be very
fun.
careful when you're giving ketamine to your patients. आपको पहले देखना है कि किसको दे रहे हो.
I remember one of my experiences with ketamine. There was this 7-8 साल का लड़का था, तो उसको इस अम्बिलिकल एरिया में जो ये है ना, वहां पर उसको कुछ सिस्ट था, तो वो रिमूव करने के लिए पीडियाट्रिक सर्जन ने उसको केटामिन दी थी. तो
7-8 साल का.
हाँ,
पीडियाट्रिक में तो we commonly use ketamine is a good drug.
Yeah, so he was given that and instantly ना वो बातें बहुत कर रहा था and he was asking for his mom and is getting little anxious, तो ketamine दे दिया उसको. उसके बाद ना वो देखने लायक था, ऐसे लेटा हुआ है वो and we are all there. तो ऐसा एकदम से he is hallucinating, proper hallucinating. हाँ, ऐसे ऊपर देख के he is in his own world.
Yeah, they get disconnected.
हाँ, पूरा डिस्कनेक्ट वो दिख रहा है जो हमने पढ़ा था ना थियोरी में.
Right.
जो dissociative anesthesia
yes,
रहता है.
it is dissociate. See, it's good when you have to separate these kids from the parents.
Yeah.
बच्चे अंदर ऐसे नहीं आते. तो यूजुअली कैसा है, पीडियाट्रिक वाले आईवी लाइन लगा के, बहुत बार आईवी लाइन होती है इन सीटू, और हमें बच्चा माँ के हाथ में है, अंदर कैसे आएगा, वो तो रोता है. पेरेंटल सेपरेशन इज समथिंग वेरी मच इट्स अ वेरी इमोशनल इवेंट फॉर दैट चाइल्ड. तो उस टाइम बाहर हम वी गिव this pre-medication. We could either give fentanyl, but with fentanyl what happens, not that all of them sleep. With ketamine they actually disconnect, they dissociate. तो माँ की गोदी से लेना आसान हो जाता है. And ketamine will not cause stopping of respiration and all so easily. The doses that you give outside, I mean in the pre-op room to take him in, it maintains respiration quite nicely. So that's the reason why we prefer using this as a agent for kids. Definitely.
All right, ma'am. This last segment that I want to do with you, it's called the thank you call. So in this, basically, आपके लाइफ में कोई भी ऐसा हो जिसने बहुत बड़ा इम्पैक्ट क्रिएट किया है, या समवन हु यू थिंक आई शुड थैंक राइट नाउ कि इनके वजह से आई एम हु आई एम राइट नाउ इन माई लाइफ. So do you have anyone who you would give a call right now? Maybe real हो सकता है call, या it could be a dummy call. It's your choice. You could either act कि आप call पे क्या बात कर रहे हो, and you could thank that person, or you could actually make a call right now.
I mean, my parents, my mother, I'm thankful to my parents for whatever I am today. I mean, you know, they were instrumental in encouraging me and making me what I am today. My teachers, but there's not one teacher. I mean, there have been many teachers who have influenced me.
Okay.
And from each one I've learned a different technique. So, you know, it'll be unfair if I can't give a call to one particular teacher. So, and of course my grandparents. मेरी दादी को भी मैं बहुत मिस करती हूँ because very much you know instrumental in making us, हमारा जो thinking है तानिया, वो मैं सोचती हूँ कभी कभी मेरे दादा दादी की वजह से है, क्योंकि उनको मैंने बहुत, they were very idealistic people, very pious, somebody whom you can idolize very absolutely. मतलब दादाजी की भी very clean practice, a very thorough gentleman, will go out of the way helping people. And on home front, dadi would teach us the difference between right and wrong. या ऐसा करोगे तो, and we are not, I mean, you know, she was not God fearing नहीं कह सकती मैं, but she actually उनकी वजह से I started praying, or you know कि there is a superpower above us. You know, लोग नास्तिक होते हैं, लोग कहते हैं कि भगवान कहाँ है, ऐसा नहीं है. There is somebody above you, and that I can in my practice also I feel that भगवान या आपको जो सुपर एक पावर है आपके ऊपर, वो आपको एक इंस्टिंक्ट, एक सिक्स्थ सेंस देता है जब प्रॉब्लम होने वाला है पेशेंट में. आई एम टेलिंग यू, विथ योर प्रैक्टिस इट विल कम. बहुत बार ऐसा भी है कि आपको यू नो मतलब कुछ गलत, ऐसे सुबह से एक फीलिंग आती है कि गलत होने वाला, बट इफ यू प्रे हार्ड, यू नो, आई मीन आई प्रे हार्ड, इट डजंट हैपन. The things go much in a better, smoother way. So all this, I am really thankful to my grandparents, and of course my parents. And I also मतलब मेरी दादी ने ही हमें एक मतलब एक ये है, I don't know if you've heard about it, Sahas Yoga meditation. तो Sahas Yoga meditation was started by Shri Nirmala Devi, श्री माता जी निर्मला देवी. एंड उनका आप सब जगह आप सुनोगे, देखोगे. शी वाज नॉट द पर्सन हु, सो आई बिलीव लाइक शी इज एन इनकार्नेशन, एंड आई डू हर मेडिटेशन. सो ऑल दिस, एंड टुडे बिकॉज आई डू दिस, probably I'm in a little bit of balance, and I can handle this stress and everything together. So again, that is thanks to my दादी, जो जिन्होंने हमें ये इनकलकेट किया हमारे अंदर कि यू नो कि ये आप करोगे तो आप सुखी रहोगे, आप अच्छा करोगे लाइफ में. and she was very forward thinking. ऐसा नहीं था कि she was always stuck in those old religious beliefs वगैरह, ऐसा कुछ भी नहीं था. Very very open and forward thinking, at the same time keeping us grounded and teaching us the basics of our traditions and things. So last but not the least, I would like to thank my husband, Dr. Bakhshi, who's been truly my better half in the true sense of the word. He has been a constant source of inspiration for me all throughout my life. He's been a constant support. He has stood by me in all my ups and downs, and I truly thank him from the bottom of my heart. So that's what I'm saying. It'll be unfair to name one person, but yes, my grandparents, my parents, and my teachers at KEM, and some of my school teachers as well. A very big thank you to my Singhania school and the teachers there. So some of them have left a lifelong impact on me. So
it was a group call to everyone.
Absolutely.
All right, ma'am, we've come to the end of the podcast. Thank you so much for being my guest today. I really enjoyed talking to you.
Thank you for inviting me, Tanya.
And your insights in anesthesiology has really helped the audience also understand that this career or the subject of anesthesia is not to be taken lightly, and also that anesthesiologists play a very important role during a surgery. Basically, surgery cannot be done without anesthesia.
Absolutely.
Thank you so much, ma'am, for all of
Thank
your
you.
insights.
Thank you for inviting me. Thank you once again.
Thank you so much for tuning in to this episode of Dr. Saab. I hope you gained a lot of insights from this deep dive into the world of anesthesia. Don't forget to like, share, and subscribe to my channel. Until then, stay tuned and see you next time.